We've all felt the impact of COVID-19, especially people in the LGBTQ+ community. 41 Action News reporter Sarah Plake explains why and has more on the effort to provide resources for that community.
A new Harvard study with the Movement Advancement Project shows that COVID-19 has negatively impacted LGBTQ households more than non-LGBTQ households, especially if they're Black or Latinx.
There tends to be worse health outcomes in general. Part of that is because of a lack of primary care. So people often in this community, particularly the transgender community, don't already have established relationships with medical providers.
Healthcare workers at Truman Medical Center say they are seeing these study results reflected in our community.
They would rather skip their medical appointments than have to come out and expose themselves to COVID. So yeah, it is definitely having an impact. And then if you can't come in for your doctor's appointments, if we can't follow up, it's hard to make sure that we can refill your medications and everything and still stay safe.
But Truman is working to make it easier by providing video visits and helping patients find health insurance. Their LGBTQ specialty clinics have mental health, endocrinologists, and primary care built in, so patients can see everyone at once without worry.
It's going to take a massive amount of effort from a city, county, state, and even federal level to address the inequities inside of the healthcare industry as it relates to LGBTQ+ people.
Inoru Wade with the Kansas City Center for Inclusion said this study highlights the issues that have existed for so long. The study says 64% of LGBTQ households have lost a job due to the pandemic, and if you're Black, that number is 95%, compared to less than half of non-LGBTQ households. A quarter of LGBTQ households couldn't get needed prescriptions. The stats just go on and on. Wade says healthcare providers who are inclusive need more support to make these stats go down.
They run on government dollars. They run on grants. And if your starting point is, well, these people don't really exist, then we're not getting the same level of funding either, which means we're just getting the short end of the stick at all angles.
Sarah Plake, 41 Action News.